A 20-year boy presents with complaints of swelling in the forearm. There is also a history of minimal swelling at this area, but it suddenly increased in size for 2 weeks and feeling severe pain. Now we start scanning the middle part of forearm. Here we see the skin, subcutaneous fat tissue and muscle layer, and this is the cortex of bone. These are the normal tissues of forearm. Now we start scanning of proximal part of the normal soft tissues to the distal part. Here we see the well-defined heterogeneous mass in the muscle layer. Now we continue scanning towards the wrist joint. Here we see the distal part of muscle layer or ligaments at wrist joint. Here the tissues are normal or shows normal echogenicity. The mass is well defined, encapsulated, and shows heterogeneous texture. Here we see the echogenic area in the mass with posterior minimal shadows. The mass is only involving the muscle layers. This is the proximal part of the muscle. And this is distal part of the muscle layers. Here we see internal echoes or flow. This mass is only involving the muscle layers. Now we will measure the size and volume of this mass. For that need 3 dimensions: length, width and height. Now we will measure the transverse view or width of the mass. And then oblique view, cross section view, length and height. The size of mass is 53 into 55 into 56 millimeter and the volume is 86.9 milliliter. Now how we will write report? A well-defined encapsulated complex mass size 53 into 56 into 55 millimeter having volume 86.9 milliliter present between the muscle layers at the anterior surface of distal part of the left forearm near wrist joint. On color Doppler, no flow present, but only internal echoes present. The ultrasound diagnosis is organized abscess at the left forearm and the patient is referred to surgeon for treatment.